Come in.
Hi, I'm Janet, and I'll be your nurse practitioner today completing your head-to-toe assessment. I'm just going to wash my hands real quick, and then we'll get started. Okay, if you will lie flat on your back, and then I will put this blanket over you to keep you covered and give you some privacy. And then if you will just pull your shirt up to right under your chest. Awesome. Okay. First, what I'm going to do is start with inspection. So I'm looking at the skin. There's no bruising, no lesions. It is appropriate for ethnicity, no rashes present. And I'm also going to look at the contour. So his abdomen is rounded, non-distended. And then I'm also looking for pulsations, peristalsis, masses or hernias, and I don't see those either. So those are not present. Next, we are going to go to auscultation. So I will take my stethoscope. And then I'm going to listen to all 4 quadrants for bowel sounds. Sometimes you have to stay for a little bit to give an accurate read on bowel sounds. So the right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. Bowel sounds are present across all 4 quadrants and are normal active. Next, I'm going to listen to the arteries. So first the aorta, then the right renal artery, the left renal artery, the left iliac artery, and the right iliac artery. And by auscultating those arteries, I do not hear any bruise present. Next, we're going to go to percussion. So I am going to listen for sounds that I hear over each quadrant. So I'll take my finger. Perfect. So through percussion, I hear tympany, which is a higher pitch over the left upper quadrant where the stomach is, and it's often filled with air and some liquid, so that makes sense. And then the right upper, right lower, and left lower quadrants have a more dullness or lower tone present, which is correct with what is there. So those more solid organs like the liver, spleen, all those things. So that sound is appropriate as well. Or that percussion sound is appropriate as well. And then next we're going to go to palpation. So first we will start with, can you scoot this up just a little bit? Okay, so first I will start with light palpation. So using the pads of my fingers, I'm looking for any tenderness, guarding that might cause, abnormal nodules, lumps, or bumps. So there's no tenderness or guarding with light palpation, and then deep palpation we're more checking for organomegaly, as well as any masses that we might feel. And palpation, both light and deep palpation are normal. There's no guarding, no tenderness, no masses or organomegaly, no hernias present either. Next, I'm going to check the spleen border or the liver borders. So I'm going to come up into the right costal margin and use the hook method. I'm going to hook my fingers right under there, and then I'm going to have him breathe in. And I can just barely palpate the liver edges. So that is normal, non-palpable, or slightly palpable. Next, I'm going to come over and palpate for the spleen. So I'm going to put one hand under and push up on the left side, and then the left costal margin, and I'm going to push in. And the spleen is non-palpable, which is normal. Then we are checking for rebound tenderness. One way that we can do this is with Rovsing's sign for appendicitis. So wherever the pain is, let's say it's the right lower quadrant, we're going to check the left lower quadrant. So we'll check the opposite side. We'll push in against that side, and then we'll let go. And if they have rebound, then it happens with that let go. and there is no rebound tenderness, so Rossing sign is negative. Then we will come over to the side and check for acute gallbladder. So we will kind of go around the same area as where we checked for the liver, and we will have the patient breathe in while we push down. And if he had to stop inhaling for any pain or even on rebound, then that would be a sign of acute gallbladder, which he does not have. Then we will palpate for the aorta. A normal width is 2.5 to 4 centimeters. So we'll come from the right side, and then the left, and that is 2.5 to 4 centimeters. So that is an appropriate angle. And then I'd like you to sit up for me, and we'll check the costovertebral angle. Kind of turn this way. We're going to check on each side the same way. So we'll put our fingers down in this lower area of the back, and we'll put our fist. We'll do it on both sides. Any tenderness or pain with that?
No.
So CVA tenderness is negative, which would signal us that there's a problem with the kidney, so pyelonephritis, a UTI, or other kidney-related issues. Okay, now we will move on to the upper extremity portion of the exam, checking cervical spine range of motion first. So I will have you copy everything I do. So chin to chest is flexion, and then look up to the sky, and that's extension. And then rotate to the left, and rotate to the right. And then we're going to lateral bend to the left, ear to shoulder, and to the right. Perfect. So that range of motion is present. Then it is cranial nerve 11. We're looking at the sternocleidomastoid specifically. So I want you to push against my hand, and then push against my hand. And then you are going to shrug your shoulders. Perfect. So that is intact as well. Next, we are going to move on to light sensation and reflexes. So I'm going to have you close your eyes, and then I'm going to touch each arm and hand, and I need you to tell me which side and where I'm touching.
Left arm, right hand, right arm, left hand.
Perfect. Now we'll move on to reflexes. So first we're going to check the bicep right here. So if you'll hold your arm out for me. Okay. And then just kind of relax it. Perfect. Then I'm going to go to the right side and check the same thing. Good job. And then we will check the triceps as well. So if you can hold your arm out like this, and now just relax it. Okay. And then the left arm, same thing. Just relax it. Perfect. And then we're going to check the brachioradialis as well. So it's right above the bone, a couple of centimeters. Okay. Perfect. And on the opposite side as well, relax. Perfect. So all reflexes are 2+ and present. Okay, and then now we're going to check range of motion. So you probably want to stand up for this. We'll do shoulders first. So I'll have him copy what I am doing. Okay, so for flexion of the shoulders, you're going to come all the way up straight in front of you. And then extension is you're going to come all the way back. Perfect. And then for abduction, you're going to come out and above your head. And then adduction is you're going to cross each side in front. And then for internal rotation, you're going to reach behind and touch your inferior scapula on each side. Perfect. And then for external rotation, put your arms out like this, and then you're just going to, perfect. All right, next we are going to move to the elbows. So for the elbows, you're going to do flexion, extension, and then supination and pronation. Then we're gonna move on to your wrist. So flexion, extension, ulnar deviation, radial deviation, out, like in, ulnar, radial. Perfect. Okay. And then next we're gonna do hands and fingers. So flexion, extension, abduction, adduction, and then you are going to do thumb opposition. Perfect. And then thumb flexion and thumb extension. Wonderful. Okay, and then now we're going to test the strength of those. So if you could just come sit here. And then turn toward the camera. Okay, so if you'll take your arms like this, we're going to check your abduction of the shoulders, the strength. So I'm pushing down here. Perfect. And then biceps is you're going to pull in. Perfect. And triceps you're going to push out. Awesome. And then do your wrists. So flexion is you're going to push down. Extension you're going to pull back. Yeah, okay, sorry. And then I need you to, you're going to try to spread your fingers against my, perfect. Spread your fingers. Perfect. And then you're going to make your circles and try to push them open. Good job. Push them open. Awesome. Okay, next we're going to move to your lower extremities. So the same thing, you're going to stand up and then do what I do. Actually, sit down first. I apologize. First we are going to check light sensation. So close your eyes and tell me which leg and foot I'm touching.
Right foot, left leg, right leg, left foot.
Perfect. Okay, and then now I'm going to check your reflexes. So we'll start with the patellar. Just relax it. Okay, and then the next side. Perfect. And then we'll do the Achilles, which is behind the ankle. So just relax your leg. 1, 2, 3. And then 1, 2, 3. Perfect. And then we're going to check your Babinski reflex. So we're going to run this along the bottom of the foot. One foot, 2 foot. And then finally, we're going to check the proprioception. So if you'll close your eyes, I'm going to move your toes up or down as you tell me which toe in which direction.
Right toe down, left toe up.
Perfect. Okay. Next, we are going to move on to your hips. So if you could stand up for me, and then you're going to copy all the movements that I do.
Okay.
Where you're in the camera. Thank you. Okay. So for your hips, you're going to do flexion, and then extension is straight back. So other side, flexion, extension, and then abduction and adduction, and then abduction and there you go, adduction. Okay, and then we're gonna do internal rotation. So your knee is gonna go in and your foot is gonna go out. So internal rotation, and then opposite is external rotation, so knee out and foot in. External rotation. Perfect. Now we're going to check your knees. So if you could flexion, like kind of more behind you, and then extension, and then flexion, extension. Perfect. And then if you could sit down for me. Okay, and then you're going to do your ankles. So plantar flexion and then dorsiflexion on each side. Plantar flexion, dorsiflexion. And then with both feet, you're going to do inversion. So together. Inversion and then eversion. Perfect. Now we're going to check strength of those muscles. So you are going to pull in for flexion, and then extension, pushing out. And then the same thing with your feet as you're gonna do dorsiflexion, so like you're hitting a gas pedal, and then plantar flexion. Perfect. So reflexes are 2+, and strength is all present and intact bilaterally. Next, what we're going to do is I'm gonna have you stand up. I'm gonna check the spine for curvature, abnormal curvatures or things. So if you could bend forward. Checking for abnormal lumps or bumps or pain or tenderness, and none of that is present. And then he is removing the pelvic range of motion, so he's bending forward. He's got anterior tilt and he's flexing. And if you lean backwards, that is a posterior tilt, and he is extending. And then you are going to rotate to each side, so left rotation, right rotation, and then left lateral bend and right lateral bend. Awesome. Okay. Now we are going to move to kind of coordination and balance. We're going to do our rapid movement. So awesome. And then next we're going to move to nose to finger. So you're going to touch your nose and then touch my finger. And then change. And that is intact and accommodating. And then you're going to take your heel to your shin and slide it down on each side. Perfect. So that is intact as well. Next, we're going to look at the vestibulocochlear nerve, which is cranial nerve 8. And we're going to do some walking. So if you'll step back, and then if you'll tandem walk for me, one foot in front of the other. Perfect. And then if you'll turn back around and toe walk. And turn back around and heel walk. And then stand back a little bit for me. We're going to do Romberg's test for balance. So you're going to close your eyes and just be still for 30 seconds. We're looking for any swaying to left or right or any abnormal movement. And it's not present, you can open your eyes. And then we're going to also check for pronator drift. So you'll hold your hands out like this and close your eyes for about 10 to 15 seconds. And if he were to start to turn and drift, that would be abnormal. But he's negative for pronator drift. Okay, and then if you could just do a shallow knee bend for me. Awesome. Do you have any questions for today?
Nope.
Okay, I will wash my hands and be done.